surgeon is still working, but everything went exactly how I wanted. I was able to basically take the hernia and kind of fold it in on itself and separate. What we do is we separate the muscle layers, and you close a layer, and then you put a piece of mesh, and then you close another layer. Now, the problem is when you do that as abdominoplasty, or we call paniculectomy, take off all that tissue, there's a big cavity, and it's going to drain a ton of fluid, and bacteria can get in there. They can get infected even. You put a piece of mesh that stays there forever. If it gets bacteria in it, it can come back and haunt you in 6 months, 2 years. It could be a problem forever. So they came up with this brilliant new mesh that's remarkably expensive, but worth its weight in gold. That's called a bioabsorbable. So this mesh goes in there, and it's there for about 18 months.
That's what you were telling me about.
So it helps everything kind of heal in an environment where it's not trying to be pulled apart. Mm-hmm. And it actually leaves behind a scar 3 times stronger than if it wasn't there. And so her abdominal wall now is back intact. Everything's back together where it was, whereas it was pulled apart like that. But on top of that, there's a piece of mesh kind of holding it in this critical period now where it's got to heal. Right. So the good news is if she does get some bacteria in there, it'll disappear. You know, there's not a foreign body to kind of hold on to it forever. So it's kind of the best of both worlds. I mean, I would love to leave a piece of mesh there forever because once it's gone, she's a bigger person and it could stretch and pull apart more. But in that critical 18 months where you're really kind of setting the scar and everything, it's going to have a time to heal. So it just went exactly how I wanted it.
Did you take those 2 muscles and pull them together? And
her muscles are completely brought back together now.
She's going to wake up going,
yeah, it's going to be tight. Yeah. So I did a block. I did a really kind of fancy block on a muscle. Still have pain, but it'll help a lot. This is what we talked about.
Now you told me, would you be so kind?
Okay, so originally we were going to do an epidural, but you know, epidural is a lot of issues. But this hurts. We tighten everything up so much; it really hurts.
That's why we both had kids with none of that. We don't like spines.
So, but I did what's called a tap block, which is where I inject this basically Novocaine that lasts 3 days in the muscles all the way around it. So she's going to have some pain, but it's going to be blunted a lot. Well, it's going to be still a lot, but it's a lot less than if she was just taking this without anything. So that doesn't have the issue with putting something in your back and increase your mobility. So Dr. DePiero will come down and talk to you when he's done, but the big part went great.
But this is what you said about her recovery time as far as actually getting on her feet will be so much quicker.
Well, yeah.
Because
when you have an epidural, you're a little bit more unsteady on your feet. This won't affect that at all. Now, there's always the 1 in 10. I've never had it, but if this numbing medicine works its way down to the femoral nerve, your legs go numb for 3 days. I've never seen it. I've heard of it. That would be the only way that we wouldn't be getting her up right away. Okay?
Great.
Recovery.
This is a 6-8 week recovery surgery. Okay. I mean, she's going to have drains for, I don't know, it could be 2 weeks, could be 4 weeks with a drain because you got to get that fluid all out of there. And it's sore, and it's gonna. This is one of those surgeries. It's a couple months of knowing it's there. Exactly. You're gonna know that repair's there forever.
6 months.
But we'll get her through it.
She's got 1 sheet of mesh or 2?
1.
Just the one that goes.
And that's the biodegradable one.
Yeah.
It'll go away. But the scar tissue could be.
The scar. Well, you want but you want the scar tissue. Okay. It's in between the muscle layers. We don't. I didn't put anything in her abdominal cavity. Didn't put anything in her subcutaneous space. It's in the perfect place. I separate her muscle layers, so it's in between there. So it's like the best space.
Good.
So in your opinion, it was very good.
Home run.
And she did okay.
She's done fine. Now she's got it. Now it's her job. Now she's got to breathe. Yeah. She's got to move.
She's got to breathe.
Sure.
It's a big deal for her anyway.
Okay. Thanks, sir. You're very welcome.
She's not lifting
Thank you,
for how long?
Very much.
Well, under 20 pounds for a long time.
Yeah. Okay.
Okay.
Thank you.
Thank you, Doctor.
So just hang out there. They'll call you when Dr.